A month ago, so this is a big change. A month ago, the 7-day average for patients hospitalized with COVID was 664, and the most recent 7-day average was 1,248. So when you're looking at those week-long averages, this is an 88% increase. Additional 583 hospitalizations in a really short period of time. And fortunately, we still are below the Delta peak for hospitalizations, but the rate of acceleration is very, very alarming. Some good news, and I think we'll ask our excellent infectious disease physicians to talk more about this, is that we are seeing evidence that there are patients that are newly sick with COVID that are not as sick as they were in the Delta wave, that people can come to the ER and some can be treated and sent home, and some are admitted to the hospital, but for a short time. Then they don't need ICU care. Some of that is still to be seen, I will say, because we are like at the beginning of the wave, so we don't know what's really going to happen. It's also important to know that Delta is still here. Omicron has not completely knocked out Delta, so we've still got some Delta folks. And this is confusing, I think, and we'll ask Dr. Lynch and Dr. Rito to talk about this more. I think it can be hard to figure out how to treat the patient because you don't know which variant they've got, and so that's tricky. But we do still have some people getting super sick. So that's actually the good news, that it doesn't seem to be causing a severe illness. And the bad news is that hospitals are really, really full and staffing is incredibly tight. And one thing that is new for us is we have a lot of hospital staff who are sick, who have tested positive. Many, got it from a holiday gathering or, from kids out in the community. So we've got a lot of folks who are calling out sick, and that is really, really worrisome. So we do not, at this moment, have room to care for even a small number of new COVID patients, and we expect these numbers to keep climbing. The case growth that we see in the community is staggering, not hospitalizations, but the number of cases. So just to remind folks, it was about 2,000 on December 1st, and it's about 8,000 on December 31st of daily new cases. And we also know that number is very much undercounted because it's hard to get a test for one reason thing, and people also are doing home tests and finding positives, and so those are not necessarily included in the number. Unlike airlines, who can cancel planes when staff call out sick, or other industries that can scale back their operations, we cannot close. We have to take everyone who walks the door. There is a federal law called the Emergency Medical Care Treatment and Active Labor Act, or EMTALA, that requires hospitals to screen and stabilize everyone who comes to their ER. So the overrun that hospitals are feeling right now is dramatic. The patients who are difficult to discharge, we've talked to you about this before, is getting worse. A lot of nursing homes have outbreaks of COVID, and so they are unable to accept new patients. We are desperate for help on difficult to discharge, truly desperate. And you'll hear about this. The number of patients who are in the hospital who have no medical need is remarkable. There's some things that we are looking for. We want right now, I think we've mentioned this before, I just want to explain it in a little more depth. In Washington State, there has been a new interpretation of law about who can consent to someone moving to a nursing home when the patient can't consent for themselves. And in Washington State, there was a new interpretation done by the state that says that a spouse or a child can't consent unless they have power of attorney. They have to get a guardianship appointed. These are the same people who can consent for care to be withdrawn. So as a spouse of someone who's in the hospital, you could consent or do not resuscitate. You could consent to the person ending care or not resuscitating the person. You could not consent to the person moving to a nursing home. This is ludicrous. It needs to be changed. We are desperate for help on that. We would like to see more COVID positive units in nursing homes so those patients can move out, more strike teams given to nursing homes. They can staff up and be ready to accept patients. Those are just a few of the pieces of help that we're asking for. But the consequence of this is that patients who need care are not getting it. Many people in the last week or two have received the very bad news that the procedure that they've been waiting for has been canceled or delayed. And these are really serious services, and it's devastating for the patient to hear it. It is very difficult for them both physically and emotionally. It's terrible for the caregiving team who's having to deliver this news. So, imagine if you've got a patient that you've promised, you've had a cancer patient and you promised them that their colostomy reversal is going to happen this week, and you call them and say, it may be a few months. I mean, that is devastating news to have to deliver. Or a cancer patient to say, we can't remove your cancerous tumor. And so the hospital clinicians are absorbing the frustration, sadness, and fear of the patients that are receiving these calls. We see ER visits going way up. Some of it's weather, some of it people who were out in the cold and got, affected by the weather. Some of it's COVID, some of it's delayed care because people have not been getting the regular care that they need. And so they're getting sicker, and the crunch in the ERs is really alarming. So we come here today with several urgent requests for the public's health. The first is, if you think you have COVID symptoms and you don't feel great, but you feel kind of fundamentally okay, you can breathe and you feel kind of more or less like you have the flu, stay home. Do not come to the emergency room. We have way, way, way too many people come to the emergency room looking for testing. The emergency rooms are not testing sites. This is especially, there's been a huge jump in people 25 to 49-year-old coming to the emergency room looking for minor COVID care. And as I mentioned before, there's a federal law that requires us to screen and stabilize every patient who comes, and it is causing a huge backlog in our ERs. It's jeopardizing care for people with true emergencies, and it is totally burning out our staff. And the other piece about this is, if you have COVID and you've got mild COVID and you come to the ER, you could be infecting someone who's there who's having a stroke or having a heart attack or got in a car wreck. So you're jeopardizing them. Please do not do this. The second piece is wear a better mask. We invite you to take your cute floral or Hello Kitty or favorite sports team cloth mask and put it right in the garbage, or maybe hang it on your wall as decoration. Or at the most, what you could do with it is put it over a surgical mask as a second layer of protection. We really want people to be wearing surgical masks, KF94s, KN95s, or N95s. These are all great options, and especially the KF95 and the KF94 and the KN95s are pretty widely available for purchase. The third piece is, I think folks heard the governor say yesterday to avoid doing in-person things if you can, just for a few weeks, and we echo that. If you can do something without being in person with others, that's a smart thing to do right now. If you can stay home or take a walk outside with a friend, do that for your own protection. And then finally, perhaps most importantly, is if you're not vaccinated, get vaccinated. If you're not boosted, get boosted. It will protect you. You are exceptionally vulnerable without it, and you are likely to take up healthcare resources someone else needs. That person who's not getting their cancerous tumor removed, there's a direct line between not getting vaccinated, taking up a hospital bed, and having that person's care delayed. So really, for the health of the community, please do that.